Good day. Welcome to All About Vision. I'm your host, Dr. Raul Henson. Today's episode deals with diabetic retinopathy, a condition when high blood sugar damages the tiny blood vessels of the retina inside the eye. It is a sight-threatening complication of diabetes, and if left untreated, can cause poor vision and even blindness. This is the show that examines the wind of the soul, our eyes. You are watching All About Vision, your ITV and more. Good day to all of you. I'm Dr. Raul Henson, your host and ophthalmologist. We are at the Clinic Henson Eye, Nose and Throat Medical Center here in Angeles City. Our episode today explains a retinal disease in persons with poorly controlled diabetes. The retina is the layer of tissue at the back of the inner eye. It changes light and images that enter the eye into nerve signals that are sent to the brain. Diabetic retinopathy can lead to poor vision and even blindness. Most of the time, it gets worse over many years. At first, the blood vessels in the eye get weak. This can lead to blood and other liquid leaking into the retina from these blood vessels. Many people with early diabetic retinopathy have no symptoms before major bleeding occurs in the eye. This is why it is important that everyone with diabetes should have regular visit to eye specialist or to an ophthalmologist. When we return, we will provide you a comprehensive discussion on the causes, types, symptoms, exams, tests, and possible complications, treatments, and prognosis of diabetic retinopathy. Stay with us. You're watching All About Vision, your ITV, and more.
Henson Eye, Ear, and Nose Throat Center, located at 066 MacArthur Highway, Angeles City. You can contact them at 045-888-0411 or 045-625-2525.
Welcome back to All About Vision. I'm your host, Dr. Raul Henson. Our guest for today is another name that we know because he's from Angeles and he's been a guest here the last time, a few episodes back. And he's also a consultant at the Clinic Henson Eye, Nose and Throat Center. Actually, he's a retina specialist. That's why he's going to explain our topic for today, which is diabetic retinopathy. Okay? Our guest had his medical education at the University of Santo Tomas and his residency program in ophthalmology at the St. Luke's Medical Center. And he also had his retina fellowship in the same center, the St. Luke's Medical Center Institute of Ophthalmology. So without further ado, our guest, Dr. Jimenez, welcome to All About Vision again.
Okay. Thank you for having me, Dr. Henson.
Well, Dr. Jimenez, our topic for today is diabetic retinopathy. You know, in Angeles, in Pampanga, there's a lot of people with diabetes, you know, because I think the food is very good here. People eat a lot. The food is delicious. So when they eat, I think it's causing them diabetes. And it's, of course, genetic. So our topic for today, diabetic retinopathy. So Dr. Jimenez, what is diabetic retinopathy?
Before I begin, thank you, Dr. Henson, for having me here. Diabetic retinopathy is a disease of the retina. That's the back part of the eye. It is a complication of diabetes. Mm-hmm. As we know, diabetes affects many parts of the body, and one part of the body is the eye, more specifically the blood vessels inside the eye. And when the blood vessels of the retina are affected because of the diabetes, uncontrolled diabetes, this part of the eye or the retina becomes affected.
Okay. How about remember, the eye is the window of the soul. So that means when we look inside the eye, can we see the diabetes inside the eye?
Well, yes, you can see it, especially even in the very early stages. You can see. You will see some exudates. No, we call them exudates, yellow and red patches or hemorrhages. Those are one of the early signs of diabetic retinopathy.
So is there a chance that an eye doctor will be the first one who will diagnose a patient with diabetes?
Well, usually that's the case. Frequently, we see patients who present with signs of diabetic retinopathy, and then that's the time when we refer the patients to the diabetologist.
But sometimes it's the other way around.
Yeah.
Sometimes there's a patient with diabetes, and they refer them to us for diabetic clearance. Is
Yes,
that right?
that's right, po.
Okay. So when there's diabetes, what happens when a patient has diabetic retinopathy? You said it's the blood vessel. The blood vessel. Okay.
Yeah.
So what happens to the blood vessel when the sugar is high?
Well, basically, the blood vessels become incompetent. They start to leak out components of the blood.
Mhm.
And once the leakages occur, the surrounding retina becomes affected. The blood supply, oxygen supply to the retina, which is the film of the eye, becomes compromised, and the vision will suffer.
Okay, so because later we'll talk about and we'll show you pictures of patients with diabetes. No? You said that diabetes can affect the other parts of the body. What other parts of the body can be affected despite the eye?
Aside from the eye, of course,
Aside from the eye.
the kidneys
Kidneys.
and the nerves.
The nerves.
Of your extremities, so your feet, your hands.
Mhm.
And indirectly also, well, other parts of your eye, your body,
Like the heart. And
like the heart and
brain.
the
So
almost
because it's
yeah.
the blood vessel, it affects almost the whole body.
Yes,
Okay.
that's right.
You know, in med school they told us that when a patient has diabetes, he has polydipsia, polyuria, polyphagia, meaning
Yes.
the patient urinates a lot, the patient is always thirsty, and is always hungry. So these are the signs of diabetes that you should look for. And if you have diabetes, you should have your eye checked and your kidneys checked. Okay. Anyway, let's go forward to our discussion. I think we're going to talk about the types of diabetes, Dr. Jimenez. So what are the types of diabetes?
Well, basically there are two types. The first is called non-proliferative, and the second is proliferative. The main distinction is the production of new vessels. When we see new vessels, retinal vessels in the eye, that means that eye has come into the proliferative stage already, and between the two, that's the worst stage. No?
Well, the proliferative stage.
Proliferative stage.
So that means in the non-proliferative stage, there's still no abnormal blood vessels.
That's right.
It's just leakage.
Yes, I think
Okay.
it's better to explain the terms with pictures.
Pictures.
So we will
Okay.
show you. We will show
Okay,
you
let's
some pictures.
show the. Okay, this is the norm. You show them first the normal. This is.
So on the right hand of the screen, no, this is the normal retina. As you can see, there's an orange background there, and that's the retina. The red lines, those are the retinal vessels. The white circle here, that's the optic nerve connecting the eye to our brain. And there's a faint red patch here, that's the macula. The macula is the center of the retina, and this is where we see things most clearly. So when you have diabetes, basically, the blood vessels become affected. They start to leak out components of our blood, and oxygenation, blood supply to the retina becomes compromised. So this is the normal retina. So when you have diabetes, no, especially on the early stage, what you will see some
Yellow dots.
yellow, whitish, or reddish dots and patches, no, forming on the back part of your retina, and those are what we call exudates and hemorrhages. And later on, if the diabetes is not controlled, this can lead to what we call the proliferative stage already.
Okay.
So this is non-proliferative.
So this is the normal. So this is the abnormal. As
That's
you
the
can see,
abnormal.
it's very different. Okay.
And this can be easily seen by the ophthalmoscope. Your general practitioner, or even your endocrinologist, your diabetologist can see this. But usually they once a patient has diabetes, they refer them to us.
Okay. So let's see the next slide. So this is the